There's a huge variety of implants. There's certainly lots of different companies, there's lots of different styles, there's lots of different shapes. When it comes to an implant, you need to choose if you want a smooth one or if you want a textured or a roughened one. Do you want just a round one? Do you want one that's teardropped and tear-shaped? And then there's obviously different dimensions depending on your chest. So they vary from about sort of 9.5 centimetres to something like 16 centimetres across for really big implants, to then having custom-made implants. So there's a huge selection. But you need to find something that's going to suit the body, I think, and that's what I always come back to. So again, breast implant choices, the surface, smooth or textured. Textured shells will promote more tissue adherence, so it stops the implant moving around. You can still feel it and move it around, but it sort of tends to sit a little better, and it's probably important with the anatomical implant, which is a teardrop one, so that it doesn't shift from one side to the other or flip right around and go upside down. They'll look quite funny that way. The shell, it's multi-layers of silicone that are sort of engineered to minimise a leak of the silicone, which is the jelly stuff, from inside the implant to around the tissues. The very early implants had a very thin shell with a very thin sort of oily silicone, and they would actually escape out of the capsule, go into the tissues and form little sand granules around in the breast tissue and into the armpits and so forth. So the world steered away from that sort of thing. In terms of the filler, there's Salerno and there's silicone gel. Now, silicone gel's undergone various generation changes. We're up to, I think, our 4th or 5th generation type, which is a very thick gel which basically sticks together. And as I said, it's like a Turkish, so if you get a Turkish delight and cut it in half, that's what an implant will look like if you cut it in half. It just doesn't leak out on the table. It just sits there, it's cohesive, so it sticks together. So it stops it leaking out of the capsule and going around the body too much. And shapes, there's round or there's anatomical ones. Now, anatomical ones are just the teardrop ones, so there's a bit more fuller breast down the bottom, less up the top. It looks more like a natural breast. Dimensions, there's obviously the projection, so that's how much they come out from the chest, okay? There's the height of them, so that's dependent on the anatomy of your body and of your chest. The width of them, again, dependent on how wide your chest is. And then there's the volume, so that's how much you want. Do you want to have 300s, do you want to have 330s, do you want to have 400s and so forth? And a bit of the volume's got to do with the dimensions of the chest. Obviously, the bigger the dimensions of the chest, the more volume you can take. So silicone versus Salerno implants. More than 90% of the implants in Australia are silicone implants. In the States, after Dow Corning went bankrupt because of the problems they had with their implants, most of them put in the States was Salerno, and they're sort of slowly converting back to silicone. It's a much better feel. The women think they're better, there's less rippling, all that sort of thing. Saline breast implants, again, tend to wrinkle and ripple a little bit. Most patients will choose a silicone breast implant over the saline implants because they've got a more natural look and a more natural feel. And there's some there that you can have a feel of a little bit later. So the cohesion of the actual silicone tends to stick together again, as I've sort of mentioned. And yeah, and just the set jelly point down the bottom. So the differences between the smooth and textured implant. Both smooth and textured implants are available in both, so that's just a round implant. You can see it's just perfectly round, sort of the same, okay? And that's an anatomical implant, so it's a bit of a teardrop. You can see it's thinner there, a bit thicker down the bottom. And again, they're both textured as opposed to a smooth one. So a smooth one, you can see it's a bit thinner, looks a bit more like it'll move around a bit more, whereas that's quite a rough, velvety surface that sticks to the tissues and doesn't move around too much. They do, I mean, that last point, most people put in textured because they do believe that it minimises the capsular contraction, so it probably increases the life of the implant a bit more. Women that have these said they feel a little bit better and they actually move around a little bit better as well. But I think that will probably give you a better result long term. I tend to prefer putting in teardrop implants. I think they just provide you with a more natural looking breast. and sort of has a little bit less filling in the upper part of the breast and more down the bottom, so they sort of hang a little bit better. If you want more fullness at the top of the breast, then obviously a round implant will give you that because it's the same size right through the whole implant. And again, it depends what you want and what you want to look like. So generally, if a patient's existing breast shape is pretty good, okay, and you just want to evenly increase the size of it, you'd probably put in a round implant. If the breast shape is not so good, then you might want to increase the bottom of the breast a little bit more, a little bit less up the top, to try and give it a more natural look and a more natural appearance. Although teardrop implants are more expensive, they're about probably double the cost. They probably look a little bit better, and it's a more superior product at the end of the day. But again, they're not for everyone.